Thank you for joining me for this BLS review. Contents covered here are streamlined and not intended to cover the entire content of the BLS course for the American Heart. If you're taking the course with me, my name is Sharina. I am your instructor, and this is what I always do for my students. So sit back, take notes if you like, and I hope you enjoy the content. Thank you. For this BLS review, we're going to focus on two main topics, the assessment and treatment. Within the assessment, we will cover scene safety, checking for responsiveness, calling for help, and breathing and pulse check. For the treatment section, we will cover ventilations, chest compressions, the AED, and choking relief. One of the first things we must do whenever we're taking care of someone else is ensuring safety. Before you even begin your CPR steps, you want to make sure the scene is safe. And they put this under the assessment portion of BLS just to make sure that we are, as providers, understanding that we too need to be safe. After you check for scene safety, it's time for you to check for responsiveness of the patient. You want to tap the shoulders and say their name if you know it. Hey, John, are you okay? If you don't get anything from the patient, then that's what we call an unresponsive patient. For an unresponsive patient, it is time for you to call for help. This is the time where you will point directly to someone and say their name and ask them to call 911 and ask for help. If you do get an arousal from your patient, you can determine what steps are best next for this patient. When it's time to call for help, definitely designate someone who's available. Point directly to someone. If you know their name, say it. Hey, Jane, call 911 and get the AED. If you are alone, use your cell phone, turn it on speaker, and dial 911. Checking for breathing and pulse. For adult victims, we will use the carotid artery. This is located under the head, on the neck, on the side. You will check for the carotid artery no more than 10 seconds. On the child or infant, you will check for the brachial artery. No more than 10 seconds for either patient for pulse check. That's an American Heart guideline, and I'm guaranteeing you will see this on your exam. So no more than 10 seconds for pulse check. If you have no breathing, but the pulse is present, prepare for rescue ventilations. Remember, pulse is present, no breathing. This term is called respiratory arrest. Ventilations. This is how we treat respiratory arrest patients. Remember, the pulse is present, but the patient's not breathing. We will breathe for the patient. For adults, you want to give a breath about every 6 seconds. You will count it. It's better if you know your rhythm. And this is how I suggest you do it. 1 and 2 and 3 and 4 and 5 and breathe. 1 and 2 and 3 and 4 and 5 and breathe. If you notice, the breath goes in on the 6th second. So take your time and practice your rhythm until you're comfortable. For a child or infant, we will give a breath every 3 seconds. Kids breathe faster than adults. So it goes like this. 1 and 2 and breathe. 1 and 2 and breathe. You can practice this again and again until you're comfortable with the rhythm that you know you can do. Again, the count is there to help you, but you'll develop your own rhythm as you give the breaths. I suggest a rhythmic method because it also keeps you calm whenever there's an emergency. Now, when you give your rescue breaths, how do you know the breaths are effective? Well, most of us know we look for the chest rise, and that's the exact right answer. The American Heart still designates the chest rise as a determination of effective breathing. If we do not see the chest rise, What should we do to improve ventilations? If the patient is unresponsive and you do not see good chest rise, the first thing you want to do is reposition the head and consider an oral airway. Adjusting the head for effective ventilations is called the head tilt chin lift. If you suspect spinal injury, will you do the head tilt chin lift? No, you will not. Instead, what will you do? Jaw thrust. The jaw thrust is the preferred method to open the airway for a patient with a suspected spinal injury. Now let's talk about chest compressions. A lot of times the American heart will use chest compressions and the term CPR interchangeably, primarily because chest compressions is the biggest component of CPR. In some cases, and especially today with COVID-19 being amongst us, it is okay and fine with the American heart if you just do chest compressions as a form of rescue. We use chest compressions whenever we suspect cardiac arrest. When do we suspect cardiac arrest? When there's no palpable pulse present. When you have taken your hand and you've placed it on the carotid artery of an adult or the brachial artery of a child and you don't feel a pulse, that's your suspicion that cardiac arrest is present. How do we determine child, adult, and infants? For an adult, if they are 8 years or above, they are an adult. Or if you see signs of puberty. For girls, that means budding of the chest, and for boys, that might mean mustaches. For a child, it would be determined between 1 year of age and 1 and 8 years of age. For an infant, it's anyone less than a year. Let's talk about the components of chest compressions. We have ratios, we have depth, we have cycles, and we have the placement for our hands on the chest, and we also have recoil. For our ratio, I like to say it like this. Everyone is 30-2 except when there are 2 people working on an infant or child. At that point, it's 15-2. I'll say it again. For adults and infants, every population is 30-2, except when you have 2 rescuers or 2 people working to save a child or infant. That's when we use 15-2. For depth, child, infant are not the same. They put child with adult. Remember, a child is anyone above 1 year of age. For child adult, on the depth, it's 2 inches. For our infants, it's 1.5 inches. How many cycles will we do of the 30-2 or the 15-2? We will always do 5 cycles, whether it's a child, adult, or infant. Whether it's 1 or 2 rescuers, 5 cycles always remain. And we should obtain 5 cycles within 2 minutes. At the end of 2 minutes, if there's an additional person available, you will want to switch compressors. At the end of 2 minutes, that's when you will also reassess for a pulse. You should achieve at least 100 to 120 compressions in 1 minute, pushing hard and fast. Your hands will be placed at the lower half of the breastbone, below the sternal notch, between the nipple lines. When you do compressions, it is also very important that you do chest recoil. That is the upward motion off the chest, allowing for blood to flow back to the heart. Let me say that better. You don't want to come off the chest. That is the upward motion of when you come up, releasing that compression, but you want to keep your hands on the patient. And that's why we bring attention to chest recoil. So you want to make sure that when you come up, you felt the chest re-expand. Again, this is when the heart receives its blood. So what is the ratio for chest compressions? For adults, 30-2. For child infant, 15 to 2. Again, everyone is 30 to 2. That's 30 compressions to 2 breaths, except for 2 rescuers working on a child infant. 2 people working on a child infant, that will be 15 to 2. So how does that go? Well, let's count it. For adults, it goes like this. 1 and 2 and 3 and 4 and 5 and 6 and all the way to 30, and breathe, breathe. 1 and 2 and 3 and 4 and all the way to 30, breathe, breathe. 1 and 2 and 3 and 4 and all the way to 30, breathe, breathe. 1 and 2 and 3 and 4 and all the way to 30, breathe, breathe. 1 and 2 and 3 and 4 and all the way to 30, breathe, breathe. That's 5 cycles. That should happen within 2 minutes. And that's your 30 to 2 ratio. If it were a child or infant and there were 2 people working on the child or infant, it would be 15 to 2. You'll get an opportunity to practice this ratio in class when you do your skills. So just make sure you understand 30 is compressions, 2 are ventilations. For child infant, when there's 2 rescuers, 15 are the amount of compressions and 2 is the amount of ventilations. We always start CPR beginning with chest compressions. So as you see, 30 represents compressions, that's where we start, and 2 represents the ventilations, and that's what we do next. So it's a 30 to 2 or 15 to 2 ratio. How far deep do we push? For adults or a child, it's 2 inches. For an infant, it's 1.5 inches. Well, how do we know how far deep we're actually pushing? In today's standards, American Heart has determined that we can now use depth perceptors. In some hospitals, some EMS trucks, they already have them active. I will show you what a depth perceptor is on class day. However, do not expect to always use one until it is widely recognized. How many cycles of CPR will we do? Well, we know 5 cycles of 30 to 2 if it's adults, 5 cycles of 15 to 2 when there's 2 people with a child or infant. At the end of 2 minutes, what will we do? Check for a pulse and switch compressors. What is it called when you come up off the chest? Recoil. Why is recoil important? It allows blood flow to return back to the heart. And just think of it this way. The heart is the organ we're trying to restart, and every organ in our body needs blood flow to survive. So if we don't allow blood to flow back to the heart, what chance are we giving it to restart? Recoil is blood flow back to the heart. The AED. What does the AED stand for? It's so funny when we ask ourselves this question. Well, we know it stands for something, and some people call it the machine, and that's fine. But now that you're a healthcare provider and you're going to be a BLS provider, I want you to know AED stands for the Automated Electrical Defibrillator, AED. And how do we use the AED? Now, I will tell you this, when you come to class, I'm not a stickler. I understand there's books and I understand there's real world scenarios. So I'm not that difficult on people as to how they go through placing the pads and getting it turned on. But I will tell you, I will want you to know that you have to follow the prompts. So if you can remember, turn it on, apply the pads, and follow the prompts, you're great. If you don't do turn it on and apply the pads in that exact order, again, I'm not going to ding you. But this is the way the American Heart expects you to know it. So when you read your test, you want to make sure you keep it in this order. Turn it on, apply the pads, and follow the prompts. Let's spend a little time talking about applying the pads. For adults, it's always going to be the upper right and the lower left. A lot of people talk about what if they have a pacemaker and things of that nature. Well, if your patient has a pacemaker, that's okay. It's usually placed on the upper left. We're going to place the pads on the upper right and the lower left. For children, we're going to place pads on the front and back. Now, if someone has patches or anything like that, yes, you want to try and avoid those things at all costs. If you can take those, I think sometimes people will have nitro pads or paint, whatever type of contact that they have on their skin that is disrupting you from applying the pads, you want to get it off. For instance, hair. A hairy chest is not a good thing. That's a huge consideration. You want to shave a hairy chest. Nonetheless, you want to apply the pads. If you have 2 sets of pads, you can use one set of pad as a wax and then apply the second set of pads for the patient to utilize for the AED, a fresh set. So you definitely want to get the hair off the patient. If the patient is in water, you want to remove the patient from the water, dry them off, and apply the pads. But the main goal here is to apply the pads, and it needs to be skin to skin contact. So no hair, no medication patches, no water in between. Well, the water is just contraindicated because of the electrical impulse you're going to send. So these are the steps. Turn it on, apply the pads, and follow the prompts. Now, let's talk a little bit about how does this AED work? Well, I want you to memorize this statement. It eliminates the abnormal heart rhythm. So it stops the bad rhythm, and we hope that the heart will restart with its own natural rhythm that is organized on its own. So it doesn't charge the heart to restart itself. It eliminates the bad rhythm, and we hope that the heart will start on its own. Let's talk about choking. How do we relieve choking in an adult? Abdominal thrusts. You'll wrap your hands around the patient with one hand over the other of your other hand in a fist. You will be above the navel, but below the xiphoid process. And you will thrust inwardly, over and over again. How long will you do this inwardly thrust? Until the object comes out or the patient passes out. If the patient passes out, call for help and lay the patient on his or her back and begin CPR, beginning with chest compressions. How do we relieve choking for an infant or child? For infants, we're going to do 5 back slaps and 5 chest thrusts. You'll continue the back slaps and the chest thrusts until the object comes out or the infant passes out on you. If the infant passes out, you want to shout for help, lay the infant on their back, and begin CPR starting with chest compressions. If it's a child, depending on their size, you get to choose whether you want to do abdominal thrusts or back slaps.